Welcome to Trailhead Health. In this video, we asked Dr. Josh Iha, doctor in Oriental Medicine and licensed acupuncturist, what his recommendation would be to someone who is thinking of working with an acupuncturist. Who is a good acupuncturist to work with? How do you pick your acupuncturist? After all, this is not a form of medicine that most people are familiar with. Here's what he had to say.
There's a lot of benefit to acupuncture and Chinese medicine. There's a lot of research about it. There's a lot I've written about it on my website, but there's also a lot of trust needed to bridge that gap. This is something very different, very foreign to our way of thinking, and a practice that we really don't understand and is really hard to experience through just a description. So part of the accessibility of Chinese medicine and acupuncture is through practitioners that are devoted and diligent and experts in their field, but also recognize that medicine is a heart-centered affair. There isn't any checklist of practitioner verification that I find necessary. Obviously, the person should be a licensed acupuncturist, and that doesn't necessarily mean that there's people that haven't gone to school that are practicing acupuncture all over, especially Minnesota, but in any part of this country. Medicine's very well regulated, and people go to jail very quickly for fraud, for saying that they're a practitioner when they're not. But there's a big difference also between a licensed acupuncturist and a certified acupuncturist, someone that did a 100-hour course or a 200-hour course. So I would be careful of practitioners that aren't specialists in acupuncture. That doesn't mean they're all bad, but it means that they should be honest with you and say, I'm going to try this, and if it doesn't work, go see a licensed acupuncturist, because the expertise level is way higher. The training is very different, between 4,000 hours to be a licensed acupuncturist and 4 full years of post-grad training and a 100 to 200 hour course for those that, yes, they got training in their field, but because acupuncture and Chinese medicine is so unique, it doesn't necessarily translate. If you have a loved one or you yourself are looking for an acupuncturist or somebody that practices Chinese medicine, I would make sure they're licensed. I would ask for referrals like you would from anybody else. And I would see if you can call or email or meet that person and see what they feel like. I think we know deep down when we found the person that gives us hope, that gives us inspiration, that has a certain level of expertise, and that is talking to our issue. Not reframing it in such a way that makes it feel foreign to us, that we have to learn this whole new lingo and this whole new culture in order to be able to get better. I think a good practitioner is relatable and makes us feel like we're ready to be freed, like we're bound up and we're seeing what those ties are binding us up. And between what we can do and the practitioner can do, we see that we can be freed. So what does it take to become a practitioner of acupuncture, doctor of acupuncture, and Oriental medicine? It takes 4 years of education, post-grad. I was in school most of my 20s learning how to do this, and then learned various techniques to make myself better as I realized there was deficiencies in what I was providing people initially. So I went on and got extra education in sports medicine, acupuncture, went and achieved my doctorate, which when I started was not part of the original training. And it's always been in an effort to be better, to be more effective, and have more patients thank me, not out the door, but even years later, saying that I made an impact on their lives and left them independent in order to be able to live more fully.